Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder of KaramMD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a very timely topic as we ending 2022 and entering 2023 about some trends that have really become very hot and super popular in 2022 and, in my opinion, are on their downswing now. And I'm going to talk to you about why that is and why you should be aware of this negative trend that is going on with some very, very popular concepts and procedures in the anti-aging space. So without further ado, let's break it down. Trend number one, deeply penetrating energy devices. Now for years, and this is not something that just became popular in 2022, but for years, there has been a lot of emphasis, innovation, thought, engineering to go into the idea that one can non-surgically lift the soft tissues of the face by putting in either radiofrequency, ultrasound, a number of other types of deeply penetrating energy into the deeper tissues in hopes of creating a surgically oriented type of a result, which basically means treating jowls and neck laxity. What we have seen with devices like Ultherapy, Thermage, Morpheus 8, Profound, all these different devices that have been mentioned, there's tons of them, and these are just a few that I just mentioned here, is that fundamentally, they don't meet the expectation of real significant results. And I'm being very kind there, by the way, by saying real significant results, because I think the overwhelming majority of people who have used many of these devices have been largely disappointed. And the reason for that is because the changes that are happening to cause the face to sag are happening at the deep layer. There's a deep layer called the fascia. The fascia starts to slide. Usually it's related to hormonal changes that are triggering the loss of sort of structural integrity of that fascia, and as a result, everything starts to slide downward and the face becomes elongated. Now, as beautiful and as wonderful as the idea sounds to be able to do something like that non-surgically by depositing a lot of energy into that deeper layer, the problem is the energy is deposited in a non-specific way, meaning that everything along the path also gets heated up. So skin, subcutaneous fat, and potentially deep fascia. And if you get a little bit deeper, depending on the facial anatomy, you can also get into problems of nerves and all those other kind of important structures that live in that general realm. So as a result of not creating too much of a problem, meaning complication, most of the energy devices don't get quite deep enough to even be able to really impact that deeper fascia layer. And when they do, there's a lot of potential consequence, but if they don't, then the person really doesn't see much of a change. And then when you do see a little bit of a change, well, the change isn't fundamental. You're not removing skin, you're not removing, and supporting the deep fascia. You're causing a little bit of energy shrinkage of that deeper layer. And as a result of that, many times in very early periods of time post-procedure, you start to see things start to retreat back to their baseline. So for a lot of people, that just doesn't cut it. And sometimes it takes something to be on the scene for a number of years before people start to get the clue and the word out from referrals and talking to their friends, etc., that, that's not such a great idea. It's not what it was, sort of put out to be as this panacea of anti-aging. And so what we're seeing is a number of people coming back after those treatments from other offices, etc. We don't have them in our practice, and complaining that they did absolutely nothing for them, and now they're wanting to have a surgical correction and treatment. So as a result of that, I think it's very, very important to keep an eye out that, and especially if you're budget-minded and want to preserve your investment capital for things that work, keep an eye on that. So let's talk about trend number two that I think is definitely on the way out, and that is thread lifting. Thread lifting came onto the scene 20 years ago in the form of permanent contour threads, and as a result of that had gone crazy. Everyone was dying over it, wanting to get a piece of this non-surgical approach to lifting. And what ended up happening was, after again 2-3 years of being on the market, people started realizing it didn't work, so it literally disappeared. It went away. There was a lot of complications associated with a lot of issues. Then 15 plus years later, it comes back in the way of these PDO or absorbable threads. And now what we're seeing is a lot of disappointment in that space as well, with results even when they do last, they're lasting 3 to 6 months at the most. There's a complication rate that's, you know, for the benefit, significant. And as a result, people are starting to become aware that they are not quite that effective, and they're quite expensive as well, and so people are deciding to opt out of those type of treatments. And I think that's for good cause. And so keep that particular one. I've done lots of videos and even on other social media channels like my Instagram and TikTok on specific information about that. So if you want a little bit more info, search on our playlist as well as looking back at some of our previous material on that. But thread lifting is on the decline. The next trend that I think is starting to become very, people are approaching very cautiously, is the treatment of the lower eyelids with filler. Now, trust me, I'm one of the very first people that started using filler under the eyes for volume augmentation, because the under eye area definitely does lose volume. But as you all know, I use fat transfer more than I use fillers. But the thing is with the lower eyes is it's not that simple. If you have a little bit of volume loss, if you're young enough or just in the early stages of volume loss and there's just a little bit of tear trough hollowing, brilliant solution, put a little bit of filler under there. I'm talking about like 0.2, maximum 0.3 cc's per eye, and it looks like a miracle, it looks amazing. But the problem is most people have a lot more volume loss than that. They're more moderate to severe volume loss. In addition, they've got extra skin and puffiness under their eyes, and as a result of that, the eyelids are in need of a lot more than filler. But what ends up happening is the injector starts putting in a lot of filler underneath the eyes, and as a result of too much filler being placed to try to overcome the puffiness, the severe volume loss, that combination requires a lot of volume, and as a result, the eyelids start to become puffy from the fillers. They start to get the Tyndall effect. They start to look unusually full and discolored in that area. And as of now, about half of our surgical patients we're requiring to remove the fillers under their eyes because it just looks so unusual. And the weird thing is it can last like 5, sometimes even 10 years after the filler is placed. So the person doesn't even realize that the unusual look around their eyes is related to the filler being placed like years ago. So people are starting to wise up about that. People are starting to question this is not a ubiquitous type of a treatment, that is, again, can be used in any type of eye condition, that there are certain eye conditions and aging changes that are perfect for filler and the other ones are just not. So for those of you who don't know that, trust me, this is something you want to remember and share, because you don't want to find yourself in that particular situation. Another type of treatment that is related to fillers that is definitely on the trending down is the idea of non-surgical fillers being used to replace surgery, right? You've heard of the non-surgical facelift or liquid facelift, things like that. And that is where a lot of volume is being placed in the outer cheeks here. A lot of volume is being placed along the jawline to get rid of the pre-jowling or a little bit at the mandible. But what ends up happening in those cases is, because you got to remember, the face is getting longer with age. It becomes more square as the face starts to settle, and the jawline is no longer like shaped like a V. It becomes heavier with jowls. So what ends up happening is when you're putting filler here and filler here, what are you doing? You're actually making the face look heavier in the lower face, which is already becoming heavier as a result of aging. And then you're putting filler out here, which is broadening this part of the face and making the face now look like a heavy rectangle, right? Remember, youth is more of like an upside down triangle and aging is more of a square. Now you're creating more of like this broader, heavier, rectangular look to the face. And that is not something that is ideal, obviously, because it really doesn't do anything to create the youthful shape. But what ends up happening is, for people who go down this road, they start this process for years and years and years, and as a result, their face starts to become deformed. You start to see that unusual change that starts to happen where the person no longer looks like themselves at all anymore because of the filler, in addition because of the aging. But the problem is then we go to try to correct it surgically by putting everything back. You're limited to some degree because the fillers have actually changed the volume levels of the face. Like you have too much volume in the middle of the face where normally you don't have that type of volume. The face has just dropped. It didn't really lose volume, but adding volume becomes an additive effect that was never there before. I hope that makes sense. Or adding volume to this part of the jawline makes the jawline look really heavy. So on the front, you look wider. On the profile, it might look a little bit better in some of these images that you see on the internet and social media stuff, but on the front, the face just looks really heavy down below. So people, again, are starting to understand that. The trend is starting to go. Even injectors and providers are starting to see the limitations of these type of treatments. In fact, I used to do a lot of fillers as part of my facial plastic surgery practice, and I stopped doing it on patients who were in their late 40s, early 50s, and mid 50s who were trying to bypass surgery by putting in a bunch of fillers. I used to think I could get away with it and help them in this way, but I realized that I wasn't doing them any favors, so I just stopped using fillers in that kind of a way. But in some small areas, fillers definitely have some value. Lip augmentation, filler in the temple, a little bit of improvement here and there, but when you start to use it in replacement, you're gonna go down a bad road. And especially if you're using it on a regular basis, keep this piece in mind, the fillers don't always completely go away, which is a huge problem because then they become a permanent part of the face. And then the final trend that is starting to really take shape is the idea that when you're in your 30s and 40s, and remember this is an idea, when you're in your 30s and 40s, that you should start using non-surgical treatments like things that I just mentioned, like fillers, like lasers, like oil therapy, like threads. Like that should be what you're doing in your 40s and 30s, to basically prevent yourself from needing to have surgery done. But with that thinking is, okay, I'm gonna do these things in my 30s and 40s, and then when I'm in my late 50s and 60s, I'll consider surgery. But what ends up happening is the person who needs those type of things in their, say, late 30s or 40s, they're genetically starting to see actual signs of aging, laxity along their jawline, perhaps even heaviness in their neck, mid-face starting to collapse, volume loss starting to happen. And what we're recognizing is this is not just, it's not like everyone at the age of 50 starts to see aging. There are people in their 30s that have always, historically have seen aging changes, that recognize that their face is just actually changing shape on them, and they've turned to those non-surgical treatments for almost a decade to a decade and a half, because that's what they thought they're supposed to do. But what we're recognizing is none of those treatments that we just mentioned, in fact, they're almost all the ones I just mentioned right now, can do anything to prevent the overall volume loss that happens with aging and prevent the sagging that happens at the fascial layer. So you're doing all those things, you're spending tons of money, you're exposing yourself to all these different risks, etc. But in the meantime, your jowls just continue to get heavier and heavier, neck starts to get more and more loose. So what people are starting to realize, again, through word of mouth, through just videos like this, etc., they're starting to recognize, hey, I've got actual aging changes that are happening to me a little bit earlier than the population norm, and it's okay. I'm gonna take care of it surgically as opposed to waste time and money on things that aren't gonna do anything. And that's a really important perspective to have. So what we're seeing is people are recognizing that the problem at hand, if it's laxity, that's surgical. If it's volume loss, well, that's ideally fat transfer, but in some ways, fillers are the only option because fat transfer surgeons are not that common. So you got to use it, but using it just to replace volume, not using it to lift, is a very different approach to volume augmentation. And then when the time is right, you pull the trigger and you have surgery, even if you are younger. And that will create a much more satisfying outcome, right? I mean, it treats the problem, it corrects the issue that you're concerned with, but also it keeps you from, prolonging the inevitable, and the inevitable means that you're not going to be happy until those things are finally done. So people holding off on surgery until they're much older is definitely becoming is a trend, is a paradigm shift that's happening where people are starting to recognize, I'm going to treat the problem when the problem happens. I'm going to reach that goal earlier than later. All right, folks, those are general 2022 going into 2023 trends that I think are dying out. And again, these are just my opinions. These are my observations. These are my thoughts. So let's see if I'm right. Let's watch and see how these things kind of play out over time, and we'll go from there. But I think there's good logic and good observation to support this. All right, folks, I hope you enjoyed this. This is definitely a video that you want to share along with some friends and family. Let them get into the conversation. And if you have any thoughts, drop them down in the comments below. If you haven't already, make sure you subscribe to the video. There's going to be a lot more topics like this in both skin education and anti-aging facial surgical stuff that you want to be aware of. And if you liked it, hit like. Love to see it. All right, folks, thank you so much. Dr. Amir Karam.